Section 48 of Gray's Anatomy, Part 2. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 2, by Henry Gray. Muscles and Fasciae of the Hand. 1F. The muscles and fasciae of the hand. The muscles of the hand are subdivided into three groups. 1. Those of the thumb, which occupy the radial side and produce the thenar eminence. 2. Those of the little finger, which occupy the ulnar side and give rise to the hypothenar eminence. 3. Those in the middle of the palm and between the metacarpal bones. Volar carpal ligament. Ligamentum carpi volare. The volar carpal ligament is the thickened band of the antebrachial fascia which extends from the radius to the ulna over the flexor tendons as they enter the wrist. Transverse carpal ligament. Ligamentum carpi transversum. Anterior annular ligament. The transverse carpal ligament is a strong fibrous band which arches over the carpus, converting the deep groove on the front of the carpal bones into a tunnel, through which the flexor tendons of the digits and the median nerve pass. It is attached medially to the pisiform and the hamulus of the hamate bones, laterally to the tuberosity of the navicular, and to the medial part of the volar surface and the ridge of the greater multangula. It is continuous above with the volar carpal ligament, and below with the palmar aponeurosis. It is crossed by the ulnar vessels and nerve, and the cutaneous branches of the median and ulnar nerves. At its lateral end is the tendon of the flexor carpi radialis, which lies in the groove on the greater multangula between the attachments of the ligament to the bone. On its volar surface, the tendons of the palmaris longus and flexor carpi ulnaris are partially inserted. Below it gives origin to the short muscles of the thumb and little finger. The mucous sheaths of the tendons on the front of the wrist. Two sheaths envelop the tendons as they pass beneath the transverse carpal ligament, one for the flexores digitorum, sublimis and profundis, and the other for the flexor pollicis longus. They extend into the forearm for about 2.5 cm above the transverse carpal ligament, and occasionally communicate with each other under the ligament. The sheath which surrounds the flexores digitorum extends downward about halfway along the metacarpal bones, where it ends in blind diverticula around the tendons to the index, middle, and ring fingers. It is prolonged on the tendons to the little finger and usually communicates with the mucous sheath of these tendons. The sheath of the tendon of the flexor pollicis longus is continued along the thumb as far as the insertion of the tendon. The mucous sheaths enveloping the terminal parts of the tendons of the flexores digitorum have been described on page 449. Dorsal carpal ligament. Ligamentum carpi dorsali, posterior annular ligament. The dorsal carpal ligament is a strong fibrous band extending obliquely downward and medialward across the back of the wrist, and consisting of part of the deep fascia of the back of the forearm, strengthened by the addition of some transverse fibres. It is attached medially to the styloid process of the ulna and to the triangular and pisiform bones, laterally to the lateral margin of the radius, and, in its passage across the wrist, to the ridges on the dorsal surface of the radius. The mucous sheaths of the tendons on the back of the wrist. Between the dorsal carpal ligament and the bones 6 compartments are formed for the passage of tendons, each compartment having a separate mucous sheath. One is found in each of the following positions. 1. On the lateral side of the styloid process, for the tendons of the abductor pollicis longus and the extensor pollicis brevis. 2. Behind the styloid process, for the tendons of the extensores carpi radialis longus and brevis. 3. About the middle of the dorsal surface of the radius, for the tendon of the extensor pollicis longus. 4. To the medial side of the latter, for the tendons of the extensor digitorum communis and extensor indicis proprius. 5. Opposite the interval between the radius and ulna, for the extensor digiti quinti proprius. 6. Between the head and styloid process of the ulna, for the tendon of the extensor carpi ulnaris. The sheaths lining these compartments extends from above the dorsal carpal ligament. Those for the tendons of abductor pollicis longus, extensor brevis pollicis, extensoris carpi radialis, and extensor carpi ulnaris stop immediately proximal to the bases of the metacarpal bones, while the sheaths for extensor communis digitorum, extensor indicis proprius, and extensor digiti quinti proprius are prolonged to the junction of the proximal and intermediate thirds of the metacarpus. Palmar aponeurosis, aponeurosis palmaris, palmar fascia. The palmar aponeurosis invests the muscles of the palm, and consists of central, lateral, and medial portions. The central portion occupies the middle of the palm, is triangular in shape, and of great strength and thickness. Its apex is continuous with the lower margin of the transverse carpal ligament, and receives the expanded tendon of the palmaris longus. Its base divides below into 4 slips, one for each finger. Each slip gives off superficial fibres to the skin of the palm and finger, those to the palm joining the skin at the furrow corresponding to the metacarpophalangeal articulations, and those to the fingers passing into the skin at the transverse fold at the bases of the fingers. The deeper part of each slip subdivides into 2 processes, which are inserted into the fibrous sheaths of the flexor tendons. From the sides of these processes offsets are attached to the transverse metacarpal ligament. By this arrangement short channels are formed on the front of the heads of the metacarpal bones. Through these the flexor tendons pass. The intervals between the 4 slips transmit the digital vessels and nerves and the tendons of the lumbricalis. At the points of division into the slips mentioned, numerous strong transverse fasciculi bind the separate processes together. The central part of the palmar aponeurosis is intimately bound to the integument by dense fibroareolar tissue forming the superficial palmar fascia, and gives origin by its medial margin to the palmaris brevis. It covers the superficial volar arch, the tendons of the flexor muscles, and the branches of the median and ulnar nerves, and on either side it gives off a septum, which is continuous with the interosseous aponeurosis, and separates the intermediate from the collateral groups of muscles. The lateral and medial portions of the palmar aponeurosis are thin, fibrous layers which cover, on the radial side, the muscles of the ball of the thumb, and on the ulnar side, the muscles of the little finger. They are continuous with the central portion and with the fascia on the dorsum of the hand. The superficial transverse ligament of the fingers is a thin band of transverse fasciculi. It stretches across the roots of the 4 fingers, and is closely attached to the skin of the clefts, and medially to the 5th metacarpal bone, forming a sort of rudimentary web. Beneath it the digital vessels and nerves pass to their destinations. The lateral volar muscles. Abductor pollicis brevis, flexor pollicis brevis, opponens pollicis, adductor pollicis obliquus, adductor pollicis transversus. The abductor pollicis brevis, abductor pollicis, is a thin, flat muscle, placed immediately beneath the integument. It arises from the transverse carpal ligament, the tuberosity of the navicular, and the ridge of the greater multangula, frequently by 2 distinct slips. Running lateralward and downward, it is inserted by a thin, flat tendon into the radial side of the base of the first phalanx of the thumb and the capsule of the metacarpophalangeal articulation. The opponens pollicis is a small, triangular muscle, placed beneath the preceding. It arises from the ridge on the greater multangula and from the transverse carpal ligament, passes downward and lateralward, and is inserted into the whole length of the metacarpal bone of the thumb on its radial side. The flexor pollicis brevis consists of 2 portions, lateral and medial. The lateral and more superficial portion arises from the lower border of the transverse carpal ligament and the lower part of the ridge on the greater multangular bone. It passes along the radial side of the tendon of the flexor pollicis longus and, becoming tendinous, is inserted into the radial side of the base of the first phalanx of the thumb. In its tendon of insertion there is a sesamoid bone. The medial and deeper portion of the muscle is very small, and arises from the ulnar side of the first metacarpal bone between the adductor pollicis obliquus and the lateral head of the first interosseous dorsalis, and is inserted into the ulnar side of the base of the first phalanx with the adductor pollicis obliquus. The medial part of the flexor brevis pollicis is sometimes described as the first interosseous volaris. The adductor pollicus obliquus (adductor obliquus pollicis) arises by several slips from the capitate bone, the bases of the second and third metacarpals, the intercarpal ligaments, and the sheath of the tendon of the flexor carpi radialis. From this origin the greater number of fibres pass obliquely downward and converge to a tendon, which, uniting with the tendons of the medial portion of the flexor pollicis brevis and the transverse part of the adductor, is inserted into the ulnar side of the base of the first phalanx of the thumb, a sesamoid bone being present in the tendon. A considerable fasciculus, however, passes more obliquely beneath the tendon of the flexor pollicis longus to join the lateral portion of the flexor brevis and the abductor pollicis brevis. The adductor pollicis transversus (adductor transversus pollicis) is the most deeply seated of this group of muscles. It is of a triangular form arising by a broad base from the lower two-thirds of the volar surface of the third metacarpal bone. The fibres converge, to be inserted with the medial part of the flexor pollicis brevis and the adductor pollicis obliquus into the ulnar side of the base of the first phalanx of the thumb. Variations. The abductor pollicis brevis is often divided into an outer and an inner part. Accessory slips from the tendon of the abductor pollicis longus or palmaris longus, more rarely from the extensor carpi radialis longus, from the styloid process or opponens pollicis, or from the skin over the thenar eminence. The deep head of the flexor pollicis brevis may be absent or enlarged. The two adductors vary in their relative extent and in the closeness of their connection. The adductor obliquus may receive a slip from the transverse metacarpal ligament. Nerves. The abductor brevis, opponens, and lateral head of the flexor pollicis brevis are supplied by the 6th and 7th cervical nerves through the median nerve, the medial head of the flexor brevis, and the adductor by the 8th cervical through the ulnar nerve. Actions. The abductor pollicis brevis draws the thumb forward in a plane at right angles to that of the palm of the hand. The adductor pollicis is the opponent of this muscle, and approximates the thumb to the palm. The opponens pollicis flexes the metacarpal bone, i.e., draws it medialward over the palm. The flexor pollicis brevis flexes and adducts the proximal phalanx. 2. The medial volar muscles. Palmaris brevis, abductor digiti quinti, flexor digiti quinti brevis, opponens digiti quinti. The palmaris brevis is a thin quadrilateral muscle placed beneath the integument of the ulnar side of the hand. It arises by tendinous fasciculi from the transverse carpal ligament and palmar aponeurosis. The fleshy fibres are inserted into the skin on the ulnar border of the palm of the hand. The abductor digiti quinti, abductor minimi digiti, is situated on the ulnar border of the palm of the hand. It arises from the pisiform bone and from the tendon of the flexor carpi ulnaris, and ends in a flat tendon, which divides into two slips. One is inserted into the ulnar side of the base of the first phalanx of the little finger, the other into the ulnar border of the aponeurosis of the extensor digiti quinti proprius. The flexor digiti quinti brevis, flexor brevis minimi digiti, lies on the same plane as the preceding muscle, on its radial side. It arises from the convex surface of the hamulus of the hamate bone, and the volar surface of the transverse carpal ligament, and is inserted into the ulnar side of the base of the first phalanx of the little finger. It is separated from the abductor, at its origin, by the deep branches of the ulnar artery and nerve. This muscle is sometimes wanting. The abductor is then usually of large size. The opponens digiti quinti, opponens minimi digiti, is of a triangular form, and placed immediately beneath the preceding muscles. It arises from the convexity of the hamulus of the hamate bone and contiguous portion of the transverse carpal ligament. It is inserted into the whole length of the metacarpal bone of the little finger, along its ulnar margin. Variations. The palmaris brevis varies greatly in size. The abductor digiti quinti may be divided into 2 or 3 slips, or united with the flexor digiti quinti brevis. Accessory head from the tendon of the flexor carpi ulnaris, the transverse carpal ligament, the fascia of the forearm or the tendon of the palmaris longus. A portion of the muscle may insert into the metacarpal or separate slips of the pisimetacarpus, pisciuncinatus or the pisciannularis muscle may exist. Nerves. All the muscles of this group are supplied by the 8th cervical nerve through the ulnar nerve. Actions. The abductor and flexor digiti quinti brevis abduct the little finger from the ring finger and assist in flexing the proximal phalanx. The opponens digiti quinti draws forward the 5th metacarpal bone, so as to deepen the hollow of the palm. The palmaris brevis corrugates the skin on the ulnar side of the palm. 3. The intermediate muscles. Lumbricalis, interossi. The lumbricalis are 4 small fleshy fasciculi associated with the tendons of the flexor digitorum profundus. The first and second arise from the radial sides and volar surfaces of the tendons of the index and middle fingers respectively. The third from the contiguous sides of the tendons of the middle and ring fingers, and the fourth from the contiguous sides of the tendons of the ring and little fingers. Each passes to the radial side of the corresponding finger, and opposite the metacarpophalangeal articulation is inserted into the tendinous expansion of the extensor digitorum communis covering the dorsal aspect of the finger. Variations. The lumbricalis vary in number from 2 to 5 or 6, and there is considerable variation in insertions. The interossi are so named from occupying the intervals between the metacarpal bones, and are divided into 2 sets, a dorsal and a volar. The interossi dorsalis, dorsal interossi, are 4 in number and occupy the intervals between the metacarpal bones. They are bipeniform muscles, each arising by 2 heads from the adjacent sides of the metacarpal bones, but more extensively from the metacarpal bone of the finger into which the muscle is inserted. They are inserted into the bases of the first phalanges and into the aponeuroses of the tendons of the extensor digitorum communis. Between the double origin of each of these muscles is a narrow triangular interval. Through the first of these the radial artery passes. Through each of the other 3 a perforating branch from the deep volar arch is transmitted. The first, or abductor indicis, is larger than the others. It is flat, triangular in form, and arises by 2 heads, separated by a fibrous arch for the passage of the radial artery from the dorsum to the palm of the hand. The lateral head arises from the proximal half of the ulnar border of the first metacarpal bone. The medial head, from almost the entire length of the radial border of the second metacarpal bone. The tendon is inserted into the radial side of the index finger. The second and third are inserted into the middle finger, the former into its radial, the latter into its ulnar side. The fourth is inserted into the ulnar side of the ring finger. The interossi volares, palmar interossi, 3 in number, are smaller than the interossi dorsalis, and placed upon the volar surfaces of the metacarpal bones, rather than between them. Each arises from the entire length of the metacarpal bone of one finger, and is inserted into the side of the base of the first phalanx and aponeurotic expansion of the extensor communis tendon to the same finger. The first arises from the ulnar side of the second metacarpal bone, and is inserted into the same side of the first phalanx of the index finger. The second arises from the radial side of the fourth metacarpal bone, and is inserted into the same side of the ring finger. The third arises from the radial side of the fifth metacarpal bone, and is inserted into the same side of the little finger. From this account it may be seen that each finger is provided with 2 interossi, with the exception of the little finger, in which the abductor takes the place of one of the pair. As already mentioned, the medial head of the flexor pollicis brevis is sometimes described as the interosseus volaris primus. Nerves. The 2 lateral lumbricalis are supplied by the 6th and 7th cervical nerves. Through the 3rd and 4th digital branches of the median nerve, the 2 medial lumbricalis and all the interossi are supplied by the 8th cervical nerve, through the deep palmar branch of the ulnar nerve. The 3rd lumbricalis frequently receives a twig from the median. Actions. The interossi volares adduct the fingers to an imaginary line drawn longitudinally through the centre of the middle finger, and the interossi dorsalis abduct the fingers from that line. In addition to this, the interossi, in conjunction with the lumbricalis, flex the first phalanges at the metacarpophalangeal joints, and extend the 2nd and 3rd phalanges in consequence of their insertions into the expansions of the extensor tendons. The extensor digitorum communis is believed to act almost entirely on the first phalanges. End of section number 48. 49 of Gray's Anatomy, Part 2. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 2, by Henry Gray. Muscles and fasciae of the iliac region. The muscles of the lower extremity are subdivided into groups corresponding with the different regions of the limb. 1. Muscles of the iliac region. 2. Muscles of the thigh. 3. Muscles of the leg. 4. Muscles of the foot. The muscles and fasciae of the iliac region. Psoas major, psoas minor, iliacus. The fascia covering the psoas and iliacus is thin above, and becomes gradually thicker below as it approaches the inguinal ligament. The portion covering the psoas is thickened above to form the medial lumbar-costal arch, which stretches from the transverse process of the first lumbar vertebra to the body of the second. Medially, it is attached by a series of arched processes to the intervertebral fibrocartilages and prominent margins of the bodies of the vertebrae, and to the upper part of the sacrum. The intervals left, opposite the constricted portions of the bodies, transmit the lumbar arteries and veins and filaments of the sympathetic trunk. Laterally, above the crest of the ilium, it is continuous with the fascia covering the front of the quadratus lumborum, while below the crest of the ilium it is continuous with the fascia covering the iliacus. The portions investing the iliacus, fascia iliaca, iliac fascia, is connected, laterally, to the whole length of the inner lip of the iliac crest, and medially to the linea terminalis of the lesser pelvis, where it is continuous with the periosteum. At the iliopectineal eminence it receives the tendon of insertion of the psoas minor, when that muscle exists. Lateral to the femoral vessels it is intimately connected to the posterior margin of the inguinal ligament, and is continuous with the transversalis fascia. Immediately lateral to the femoral vessels the iliac fascia is prolonged backward and medialward from the inguinal ligament as a band, the iliopectineal fascia, which is attached to the iliopectineal eminence. This fascia divides the space between the inguinal ligament and the hip bone into two lacunae or compartments, the medial of which transmits the femoral vessels, the lateral the psoas major and iliacus and the femoral nerve. Medial to the vessels the iliac fascia is attached to the pectineal line behind the inguinal aponeurotic falx, where it is again continuous with the transversalis fascia. On the thigh the fascia of the iliacus and psoas form a single sheet termed the iliopectineal fascia. Where the external iliac vessels pass into the thigh, the fascia descends behind them, forming the posterior wall of the femoral sheath. The portion of the iliopectineal fascia which passes behind the femoral vessels is also attached to the pectineal line beyond the limits of the attachment of the inguinal aponeurotic falx. At this part it is continuous with the pectineal fascia. The external iliac vessels lie in front of the iliac fascia, but all the branches of the lumbar plexus are behind it. It is separated from the peritoneum by a quantity of loose areolar tissue. The psoas major, psoas magnus, is a long fusiform muscle placed on the side of the lumbar region of the vertebral column and brim of the lesser pelvis. It arises 1. From the anterior surfaces of the bases and lower borders of the transverse processes of all the lumbar vertebra. 2. From the sides of the bodies and the corresponding intervertebral fibrocartilages of the last thoracic and all the lumbar vertebrae by 5 slips, each of which is attached to the adjacent upper and lower margins of 2 vertebrae, and to the intervertebral fibrocartilage. 3. From a series of tendinous arches which extend across the constricted parts of the bodies of the lumbar vertebrae between the previous slips, the lumbar arteries and veins, and filaments from the sympathetic trunk pass beneath these tendinous arches. The muscle proceeds downward across the brim of the lesser pelvis, and diminishing gradually in size, passes beneath the inguinal ligament and in front of the capsule of the hip joint and ends in a tendon. The tendon receives nearly the whole of the fibers of the iliacus and is inserted into the lesser trochanter of the femur. A large bursa which may communicate with the cavity of the hip joint separates the tendon from the pubis and the capsule of the joint. The psoas minor, psoas parvus, is a long slender muscle, placed in front of the psoas major. It arises from the sides of the bodies of the 12th thoracic and 1st lumbar vertebra, and from the fibrocartilage between them. It ends in a long flat tendon which is inserted into the pectineal line and iliopectineal eminence, and, by its lateral border, into the iliac fascia. This muscle is often absent. The iliacus is a flat, triangular muscle, which fills the iliac fossa. It arises from the upper two-thirds of this fossa, and from the inner lip of the iliac crest, behind, from the anterior sacroiliac and the iliolumbar ligaments, and base of the sacrum. In front it reaches as far as the anterior superior and anterior inferior iliac spines, and the notch between them. The fibres converge to be inserted into the lateral side of the tendon of the psoas major, some of them being prolonged on the body of the femur for about 2.5 cm below and in front of the lesser trochanter. Note 85. The psoas major and iliacus are sometimes regarded as a single muscle named the iliopsoas. End of Note 85. Variations. The iliacus minor or iliocapsularis, a small detached part of the iliacus, is frequently present. It arises from the anterior inferior spine of the ilium, and is inserted into the lower part of the intertrochanteric line of the femur or into the iliofemoral ligament. Nerves. The psoas major is supplied by branches of the second and third lumbar nerve, the psoas minor by a branch of the first lumbar nerve, and the iliacus by branches of the second and third lumbar nerves through the femoral nerve. Actions. The psoas major, acting from above, flexes the thigh upon the pelvis, being assisted by the iliacus. Acting from below, with the femur fixed, it bends the lumbar portion of the vertebral column forward and to its own side, and then, in conjunction with the iliacus, tilts the pelvis forward. When the muscles of both sides are acting from below, they serve to maintain the erect posture by supporting the vertebral column and pelvis upon the femora, or in continued action bend the trunk and pelvis forward, as in raising the trunk from the recumbent posture. The psoas minor is a tensor of the iliac fascia. End of section number 49.
Of Gray's Anatomy, Part 2. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information, or to volunteer, please visit LibriVox.org. Anatomy of the Human Body, Part 2, by Henry Gray. The Muscles and Fasciae of the Thigh, Part 1. 1. The anterior femoral muscles. Sartorius, quadriceps femoris, rectus femoris, vastus lateralis, vastus medialis, vastus intermedius, articularis genu. Superficial fascia. The superficial fascia forms a continuous layer over the whole of the thigh. It consists of areolar tissue containing in its meshes much fat, and may be separated into 2 or more layers, between which are found the superficial vessels and nerves. It varies in thickness in different parts of the limb. In the groin it is thick, and the 2 layers are separated from one another by the superficial inguinal lymph glands, the great saphenous vein, and several smaller vessels. The superficial layer is continuous above with the superficial fascia of the abdomen. The deep layer of the superficial fascia is a very thin, fibrous stratum, best marked on the medial side of the great saphenous vein and below the inguinal ligament. It is placed beneath the subcutaneous vessels and nerves and upon the surface of the fascia lata. It is intimately adherent to the fascia lata, a little below the inguinal ligament. It covers the fossa ovalis, saphenous opening, being closely united to its circumference, and is connected to the sheath of the femoral vessels. The portion of fascia covering this fossa is perforated by the great saphenous vein and by numerous blood and lymphatic vessels. Hence it has been termed the fascia cribrosa, the openings for these vessels having been likened to the holes in a sieve. A large subcutaneous bursa is found in the superficial fascia over the patella. Deep fascia. The deep fascia of the thigh is named, from its great extent, the fascia lata. It constitutes an investment for the whole of this region of the limb, but varies in thickness in different parts. Thus it is thicker in the upper and lateral part of the thigh, where it receives a fibrous expansion from the gluteus maximus, and where the tensor fasciolati is inserted between its layers. It is very thin behind and at the upper and medial part, where it covers the adductor muscles and again becomes stronger around the knee, receiving fibrous expansions from the tendon of the biceps femoris laterally, from the sartorius medially, and from the quadriceps femoris in front. The fascia lata is attached, above and behind, to the back of the sacrum and coccyx, laterally to the iliac crest, in front to the inguinal ligament, and to the superior ramus of the pubis, and medially to the inferior ramus of the pubis, to the inferior ramus and tuberosity of the ischium, and to the lower border of the sacrotuberous ligament. From its attachment to the iliac crest, it passes down over the gluteus medius to the upper border of the gluteus maximus, where it splits into two layers, one passing superficial to and the other beneath this muscle. At the lower border of the muscle the two layers reunite. Laterally, the fascia lata receives the greater part of the tendon of insertion of the gluteus maximus, and becomes proportionately thickened. The portion of the fascia lata attached to the front part of the iliac crest and corresponding to the origin of the tensor fasciolati extends down the lateral side of the thigh as two layers, one superficial to and the other beneath this muscle. At the lower end of the muscle these two layers unite and form a strong band, having first received the insertion of the muscle. This band is continued downward under the name of the iliotibial band, tractus iliotibialis, and is attached to the lateral condyle of the tibia. The part of the iliotibial band which lies beneath the tensor fasciolati is prolonged upward to join the lateral part of the capsule of the hip joint. Below, the fascia lata is attached to all the prominent points around the knee joint, viz., the condyles of the femur and tibia, and the head of the fibula. On either side of the patella it is strengthened by transverse fibers from the lower parts of the vasti, which are attached to and support this bone. Of these, the lateral are the stronger, and are continuous with the iliotibial band. The deep surface of the fascia lata gives off two strong intermuscular septa, which are attached to the whole length of the linea aspera and its prolongations above and below. The lateral and stronger one, which extends from the insertion of the gluteus maximus to the lateral condyle, separates the vastus lateralis in front from the short head of the biceps femoris behind, and gives partial origin to these muscles. The medial and thinner one separates the vastus medialis from the adductores and pectineus. Besides these, there are numerous smaller septa, separating the individual muscles and enclosing each in a distinct sheath. The fossa ovalis, saphenous opening. At the upper and medial part of the thigh, a little below the medial end of the inguinal ligament, is a large oval-shaped aperture in the fascia lata. It transmits the great saphenous vein and other smaller vessels, and is termed the fossa ovalis. The fascia cribrosa, which is pierced by the structures passing through the opening, closes the aperture and must be removed to expose it. The fascia lata in this part of the thigh is described as consisting of a superficial and a deep portion. The superficial portion of the fascia lata is the part on the lateral side of the fossa ovalis. It is attached laterally to the crest and anterior superior spine of the ilium, to the whole length of the inguinal ligament, and to the pectineal line in conjunction with the lacunar ligament. From the tubercle of the pubis it is reflected downward and lateralward as an arched margin, the fossiform margin. Forming the lateral boundary of the fossa ovalis, this margin overlies and is adherent to the anterior layer of the sheath of the femoral vessels. To its edge is attached the fascia cribrosa. The upward and medial prolongation of the fossiform margin is named the superior cornu, its downward and medial prolongation the inferior cornu. The latter is well defined, and is continuous behind the great saphenous vein with the pectineal fascia. The deep portion is situated on the medial side of the fossa ovalis, and at the lower margin of the fossa is continuous with the superficial portion. Traced upward, it covers the pectineus, adductor longus, and gracilis, and, passing behind the sheath of the femoral vessels to which it is closely united, is continuous with the iliopectineal fascia, and is attached to the pectineal line. From this description it may be observed that the superficial portion of the fascia lata lies in front of the femoral vessels, and the deep portion behind them, so that an apparent aperture exists between the two, through which the great saphenous passes to join the femoral vein. The sartorius, the longest muscle in the body, is narrow and ribbon-like. It arises by tendinous fibers from the anterior superior iliac spine and the upper half of the notch below it. It passes obliquely across the upper and anterior part of the thigh, from the lateral to the medial side of the limb, then descends vertically as far as the medial side of the knee, passing behind the medial condyle of the femur to end in a tendon. This curves obliquely forward and expands into a broad aponeurosis, which is inserted in front of the gracilis and semitendinous into the upper part of the medial surface of the body of the tibia, nearly as far forward as the anterior crest. The upper part of the aponeurosis is curved backward over the upper edge of the tendon of the gracilis so as to be inserted behind it. An offset from its upper margin blends with the capsule of the knee joint, and another from its lower border, with the fascia on the medial side of the leg. Variations. Slips of origin from the outer end of the inguinal ligament, the notch of the ilium, the iliopectineal line, or the pubis occur. The muscle may be split into two parts, and one part may be inserted into the fascia lata, the femur, the ligament of the patella, or the tendon of the semitendinosus. The tendon of insertion may end in the fascia lata, the capsule of the knee joint, or the fascia of the leg. The muscle may be absent. The quadriceps femoris, quadriceps extensor, includes the four remaining muscles on the front of the thigh. It is the great extensor muscle of the leg, forming a large fleshy mass which covers the front and sides of the femur. It is subdivided into separate portions which have received distinctive names. One occupying the middle of the thigh and connected above with the ilium is called from its straight course the rectus femoris. The other three lie in immediate connection with the body of the femur, which they cover from the trochanters to the condyles. The portion on the lateral side of the femur is termed the vastus lateralis, that covering the medial side, the vastus medialis, and that in front, the vastus intermedius. The rectus femoris is situated in the middle of the front of the thigh. It is fusiform in shape, and its superficial fibers are arranged in a bipiniform manner, the deep fibers running straight down to the deep aponeurosis. It arises by two tendons, one, the anterior or straight, from the anterior inferior iliac spine, the other, the posterior or reflected, from a groove above the brim of the acetabulum. The two unite at an acute angle and spread into an aponeurosis which is prolonged downward on the anterior surface of the muscle, and from this the muscular fibers arise. The muscle ends in a broad and thick aponeurosis which occupies the lower two-thirds of its posterior surface, and, gradually becoming narrowed into a flattened tendon, is inserted into the base of the patella. The vastus lateralis, vastus externus, is the largest part of the quadriceps femoris. It arises by a broad aponeurosis, which is attached to the upper part of the intertrochanteric line, to the anterior and inferior borders of the greater trochanter, to the lateral lip of the gluteal tuberosity, and to the upper half of the lateral lip of the linea aspera. This aponeurosis covers the upper three-fourths of the muscle, and from its deep surface many fibers take origin. A few additional fibers arise from the tendon of the gluteus maximus and from the lateral intermuscular septum between the vastus lateralis and short head of the biceps femoris. The fibers form a large fleshy mass, which is attached to a strong aponeurosis placed on the deep surface of the lower part of the muscle. This aponeurosis becomes contracted and thickened into a flat tendon inserted into the lateral border of the patella, blending with the quadriceps femoris tendon and giving an expansion to the capsule of the knee joint. The vastus medialis and vastus intermedius appear to be inseparably united, but when the rectus femoris has been reflected, a narrow interval will be observed extending upward from the medial border of the patella between the two muscles, and the separation may be continued as far as the lower part of the intertrochanteric line, where, however, the two muscles are frequently continuous. The vastus medialis, vastus internus, arises from the lower half of the intertrochanteric line, the medial lip of the linea aspera, the upper part of the medial supracondylar line, the tendons of the adductor longus and the adductor magnus, and the medial intermuscular septum. Its fibers are directed downward and forward, and are chiefly attached to an aponeurosis which lies on the deep surface of the muscle and is inserted into the medial border of the patella and the quadriceps femoris tendon, an expansion being sent to the capsule of the knee joint. The vastus intermedius, crorius, arises from the front and lateral surfaces of the body of the femur in its upper 2/3 and from the lower part of the lateral intermuscular septum. Its fibers end in a superficial aponeurosis, which forms the deep part of the quadriceps femoris tendon. The tendons of the different portions of the quadriceps unite at the lower part of the thigh, so as to form a single strong tendon, which is inserted into the base of the patella, some few fibers passing over it to blend with the ligamentum patellae. More properly, the patella may be regarded as a sesamoid bone, developed in the tendon of the quadriceps, and the ligamentum patellae, which is continued from the apex of the patella to the tuberosity of the tibia, as the proper tendon of insertion of the muscle, the medial and lateral patellar retinacula being expansions from its borders. A bursa, which usually communicates with the cavity of the knee joint, is situated between the femur and the portion of the quadriceps tendon above the patella. Another is interposed between the tendon and the upper part of the front of the tibia, and a third, the prepatellar bursa, is placed over the patella itself. The articularis genu, subcroreus, is a small muscle, usually distinct from the vastus intermedius, but occasionally blended with it. It arises from the anterior surface of the lower part of the body of the femur and is inserted into the upper part of the synovial membrane of the knee joint. It sometimes consists of several separate muscular bundles. Nerves. The muscles of this region are supplied by the second, third, and fourth lumbar nerves through the femoral nerve. Actions. The sartorius flexes the leg upon the thigh and, continuing to act, flexes the thigh upon the pelvis. It next abducts and rotates the thigh outward. When the knee is bent, the sartorius assists the semitendinosus, semimembranosus, and popliteus in rotating the tibia inward. Taking its fixed point from the leg, it flexes the pelvis upon the thigh and, if one muscle acts, assists in rotating the pelvis. The quadriceps femoris extends the leg upon the thigh. The rectus femoris assists the psoas major and iliacus in supporting the pelvis and trunk upon the femur. It also assists in flexing the thigh on the pelvis, or if the thigh be fixed, it will flex the pelvis. The vastus medialis draws the patella medialward as well as upward. 2. The medial femoral muscles. Gracilis, pectineus, adductor longus, adductor brevis, adductor magnus. The gracilis is the most superficial muscle on the medial side of the thigh. It is thin and flattened, broad above, narrow and tapering below. It arises by a thin aponeurosis from the anterior margins of the lower half of the symphysis pubis and the upper half of the pubic arch. The fibers run vertically downward and end in a rounded tendon which passes behind the medial condyle of the femur, curves around the medial condyle of the tibia, where it becomes flattened and is inserted into the upper part of the medial surface of the body of the tibia, below the condyle. A few of the fibers of the lower part of the tendon are prolonged into the deep fascia of the leg. At its insertion, the tendon is situated immediately above that of the semitendinosus, and its upper edge is overlapped by the tendon of the sartorius, with which it is in part blended. It is separated from the tibial collateral ligament of the knee joint by a bursa common to it and the tendon of the semitendinosus. The pectineus is a flat quadrangular muscle situated at the anterior part of the upper and medial aspect of the thigh. It arises from the pectineal line, and to a slight extent from the surface of bone in front of it between the iliopectineal eminence and tubercle of the pubis, and from the fascia covering the anterior surface of the muscle. The fibers pass downward, backward, and lateralward to be inserted into a rough line leading from the lesser trochanter to the linea aspera. The adductor longus, the most superficial of the three adductories, is a triangular muscle, lying in the same plane as the pectineus. It arises by a flat, narrow tendon from the front of the pubis at the angle of junction of the crest with the symphysis, and soon expands into a broad fleshy belly. This passes downward, backward, and lateralward, and is inserted by an aponeurosis into the linea aspera between the vastus medialis and the adductor magnus, with both of which it is usually blended. The adductor brevis is situated immediately behind the two preceding muscles. It is somewhat triangular in form and arises by a narrow origin from the outer surfaces of the superior and inferior rami of the pubis, between the gracilis and obturator externus. Its fibers, passing backward, lateralward, and downward, are inserted by an aponeurosis into the line leading from the lesser trochanter to the linea aspera and into the upper part of the linea aspera, immediately behind the pectineus and upper part of the adductor longus. The adductor magnus is a large triangular muscle situated on the medial side of the thigh. It arises from a small part of the inferior ramus of the pubis, from the inferior ramus of the ischium, and from the outer margin of the inferior part of the tuberosity of the ischium. Those fibers which arise from the ramus of the pubis are short, horizontal in direction, and are inserted into the rough line leading from the greater trochanter to the linea aspera, medial to the gluteus maximus. Those from the ramus of the ischium are directed downward and lateralward with different degrees of obliquity, to be inserted, by means of a broad aponeurosis, into the linea aspera and the upper part of its medial prolongation below. The medial portion of the muscle, composed principally of the fibers arising from the tuberosity of the ischium, forms a thick fleshy mass consisting of coarse bundles which descend almost vertically and end about the lower third of the thigh in a rounded tendon which is inserted into the adductor tubercle on the medial condyle of the femur, and is connected by a fibrous expansion to the line leading upward from the tubercle to the linea aspera. At the insertion of the muscle, there is a series of osseo-aponeurotic openings, formed by tendinous arches attached to the bone. The upper four openings are small, and give passage to the perforating branches of the profunda femoris artery. The lowest is of large size, and transmits the femoral vessels to the popliteal fossa. Variations. The pectineus is sometimes divided into an outer part supplied by the femoral nerve, and an inner part supplied by the obturator nerve. The muscle may be attached to, or inserted into the capsule of the hip joint. The adductor longus may be double, may extend to the knee, or be more or less united with the pectineus. The adductor brevis may be divided into 2 or 3 parts, or it may be united to the adductor magnus. The adductor magnus may be more or less segmented. The anterior and superior portion is often described as a separate muscle, the adductor minimus. The muscle may be fused with the quadratus femoris. Nerves. The three adductories and the gracilis are supplied by the third and fourth lumbar nerves through the obturator nerve, the adductor magnus receiving an additional branch from the sacral plexus through the sciatic. The pectineus is supplied by the second, third, and fourth lumbar nerves through the femoral nerve, and by the third lumbar through the accessory obturator when this latter exists. Occasionally it receives a branch from the obturator nerve. Note 86. The pectineus may consist of two incompletely separated strata. The lateral or dorsal stratum, which is constant, is supplied by a branch from the femoral nerve, or in the absence of this branch by the accessory obturator nerve. The medial or ventral stratum, when present, is supplied by the obturator nerve. A. M. Patterson, Journal of Anatomy and Physiology, 26/43. Actions. The pectineus and three adductories adduct the thigh powerfully. They are especially used in horse exercise, the size of the saddle being grasped between the knees by the contraction of these muscles. In consequence of the obliquity of their insertions into the linea aspera, they rotate the thigh outward, assisting the external rotators, and when the limb has been abducted, they draw it medialward, carrying the thigh across that of the opposite side. The pectineus and adductories brevis and longus assist the psoas major and iliacus in flexing the thigh upon the pelvis. In progression, all these muscles assist in drawing forward the lower limb. The gracilis assists the sartorius in flexing the leg and rotating it inward. It is also an adductor of the thigh. If the lower extremities be fixed, these muscles, taking their fixed points below, may act upon the pelvis, serving to maintain the body in an erect posture, or, if their action be continued, flex the pelvis forward upon the femur. End of section 50. Recording by Selena Arter. Gray's Anatomy, Part 2. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Anatomy of the Human Body, Part 2, by Henry Gray. The Muscles and Fasciae of the Thigh, Part 2. 3. The Muscles of the Gluteal Region. Gluteus maximus, Gluteus medius, Gluteus minimus, Tensor fasciae lati, piriformis, obturator internus, gemellus superior, gemellus inferior, quadratus femoris, obturator externus. The gluteus maximus, the most superficial muscle in the gluteal region, is a broad and thick fleshy mass of a quadrilateral shape, and forms the prominence of the nates. Its large size is one of the most characteristic features of the muscular system in man, connected as it is with the power he has of maintaining the trunk in the erect posture. The muscle is remarkably coarse in structure, being made up of fasciculi lying parallel with one another and collected together into large bundles separated by fibrous septa. It arises from the posterior gluteal line of the ilium, and the rough portion of bone including the crest, immediately above and behind it. From the posterior surface of the lower part of the sacrum and the side of the coccyx. From the aponeurosis of the sacrospinalis, the sacrotuberous ligament, and the fascia, gluteal aponeurosis, covering the gluteus medius. The fibers are directed obliquely downward and lateralward, those forming the upper and larger portion of the muscle, together with the superficial fibers of the lower portion, end in a thick tendinous lamina, which passes across the greater trochanter and is inserted into the iliotibial band of the fascia lata. The deeper fibers of the lower portion of the muscle are inserted into the gluteal tuberosity between the vastus lateralis and adductor magnus. Bursae. 3 bursae are usually found in relation with the deep surface of this muscle. One of these, of large size and generally multilocular, separates it from the greater trochanter. A second, often wanting, is situated on the tuberosity of the ischium. A third is found between the tendon of the muscle and that of the vastus lateralis. The gluteus medius is a broad, thick, radiating muscle situated on the outer surface of the pelvis. Its posterior third is covered by the gluteus maximus, its anterior 2/3 by the gluteal aponeurosis, which separates it from the superficial fascia and integument. It arises from the outer surface of the ilium between the iliac crest and posterior gluteal line above, and the anterior gluteal line below. It also arises from the gluteal aponeurosis covering its outer surface. The fibers converge to a strong flattened tendon, which is inserted into the oblique ridge which runs downward and forward on the lateral surface of the greater trochanter. A bursa separates the tendon of the muscle from the surface of the trochanter over which it glides. Variations. The posterior border may be more or less closely united to the piriformis, or some of the fibers end on its tendon. The gluteus minimus, the smallest of the 3 gluteae, is placed immediately beneath the preceding. It is fan-shaped, arising from the outer surface of the ilium between the anterior and inferior gluteal lines, and behind, from the margin of the greater sciatic notch. The fibers converge to the deep surface of a radiated aponeurosis, and this ends in a tendon which is inserted into an impression on the anterior border of the greater trochanter, and gives an expansion to the capsule of the hip joint. A bursa is interposed between the tendon and the greater trochanter. Between the gluteus medius and gluteus minimus are the deep branches of the superior gluteal vessels and the superior gluteal nerve. The deep surface of the gluteus minimus is in relation with the reflected tendon of the rectus femoris and the capsule of the hip joint. Variations. The muscle may be divided into an anterior and a posterior part, or it may send slips to the piriformis, the gemellus superior, or the outer part of the origin of the vastus lateralis. The tensor fasciae lati, tensor fasciae femoris, arises from the anterior part of the outer lip of the iliac crest, from the outer surface of the anterior superior iliac spine, and part of the outer border of the notch below it, between the gluteus medius and sartorius, and from the deep surface of the fascia lata. It is inserted between the 2 layers of the iliotibial band of the fascia lata about the junction of the middle and upper thirds of the thigh. The piriformis is a flat muscle, pyramidal in shape, lying almost parallel with the posterior margin of the gluteus medius. It is situated partly within the pelvis against its posterior wall, and partly at the back of the hip joint. It arises from the front of the sacrum by 3 fleshy digitations, attached to the portions of bone between the first, second, third, and fourth anterior sacral foramina, and to the grooves leading from the foramina. A few fibers also arise from the margin of the greater sciatic foramen and from the anterior surface of the sacrotuberous ligament. The muscle passes out of the pelvis through the greater sciatic foramen, the upper part of which it fills, and is inserted by a rounded tendon into the upper border of the greater trochanter behind, but often partly blended with the common tendon of the obturator internus and gemelli. Variations. It is frequently pierced by the common peroneal nerve, and thus divided more or less into 2 parts. It may be united with the gluteus medius, or send fibers to the gluteus minimus, or receive fibers from the gemellus superior. It may have only 1 or 2 sacral attachments, or be inserted into the capsule of the hip joint. It may be absent. Obturator membrane. The obturator membrane is a thin fibrous sheet, which almost completely closes the obturator foramen. Its fibers are arranged in interlacing bundles mainly transverse in direction. The uppermost bundle is attached to the obturator tubercles and completes the obturator canal for the passage of the obturator vessels and nerve. The membrane is attached to the sharp margin of the obturator foramen except at its lower lateral angle, where it is fixed to the pelvic surface of the inferior ramus of the ischium, i.e., within the margin. Both obturator muscles are connected with this membrane. The obturator internus is situated partly within the lesser pelvis, and partly at the back of the hip joint. It arises from the inner surface of the anterolateral wall of the pelvis, where it surrounds the greater part of the obturator foramen, being attached to the inferior rami of the pubis and ischium, and at the side to the inner surface of the hip bone, below and behind the pelvic brim, reaching from the upper part of the greater sciatic foramen above and behind to the obturator foramen below and in front. It also arises from the pelvic surface of the obturator membrane except in the posterior part, from the tendinous arch which completes the canal for the passage of the obturator vessels and nerve, and to a slight extent from the obturator fascia, which covers the muscle. The fibers converge rapidly toward the lesser sciatic foramen, and end in 4 or 5 tendinous bands, which are found on the deep surface of the muscle. These bands are reflected at a right angle over the grooved surface of the ischium between its spine and tuberosity. This bony surface is covered by smooth cartilage, which is separated from the tendon by a bursa, and presents one or more ridges corresponding with the furrows between the tendinous bands. These bands leave the pelvis through the lesser sciatic foramen and unite into a single flattened tendon, which passes horizontally across the capsule of the hip joint, and after receiving the attachments of the gemelli, is inserted into the forepart of the medial surface of the greater trochanter above the trochanteric fossa. A bursa, narrow and elongated in form, is usually found between the tendon and the capsule of the hip joint. It occasionally communicates with the bursa between the tendon and the ischium. The gemelli are 2 small muscular fasciculi, accessories to the tendon of the obturator internus, which is received into a groove between them. The gemellus superior, the smaller of the 2, arises from the outer surface of the spine of the ischium, blends with the upper part of the tendon of the obturator internus, and is inserted with it into the medial surface of the greater trochanter. It is sometimes wanting. The gemellus inferior arises from the upper part of the tuberosity of the ischium, immediately below the groove for the obturator internus tendon. It blends with the lower part of the tendon of the obturator internus, and is inserted with it into the medial surface of the greater trochanter, rarely absent. The quadratus femoris is a flat quadrilateral muscle between the gemellus inferior and the upper margin of the adductor magnus. It is separated from the latter by the terminal branches of the medial femoral circumflex vessels. It arises from the upper part of the external border of the tuberosity of the ischium, and is inserted into the upper part of the linea quadrata, that is, the line which extends vertically downward from the intertrochanteric crest. A bursa is often found between the front of this muscle and the lesser trochanter, sometimes absent. The obturator externus is a flat triangular muscle which covers the outer surface of the anterior wall of the pelvis. It arises from the margin of bone immediately around the medial side of the obturator foramen, viz., from the rami of the pubis and the inferior ramus of the ischium. It also arises from the medial 2/3 of the outer surface of the obturator membrane, and from the tendinous arch which completes the canal for the passage of the obturator vessels and nerves. The fibers springing from the pubic arch extend on to the inner surface of the bone, where they obtain a narrow origin between the margin of the foramen and the attachment of the obturator membrane. The fibers converge and pass backward, lateralward, and upward, and end in a tendon which runs across the back of the neck of the femur and lower part of the capsule of the hip joint, and is inserted into the trochanteric fossa of the femur. The obturator vessels lie between the muscle and the obturator membrane. The anterior branch of the obturator nerve reaches the thigh by passing in front of the muscle, and the posterior branch by piercing it. Nerves. The gluteus maximus is supplied by the 5th lumbar and 1st and 2nd sacra nerves through the inferior gluteal nerve, the gluteus medius and minimus, and the tensor fasciae lati by the 4th and 5th lumbar and 1st sacral nerves through the superior gluteal. The piriformis is supplied by the 1st and 2nd sacral nerves, the gemellus inferior and quadratus femoris by the last lumbar and 1st sacral nerves, the gemellus superior and obturator internus by the 1st, 2nd, and 3rd sacral nerves, and the obturator externus by the 3rd and 4th lumbar nerves through the obturator. Actions. When the gluteus maximus takes its fixed point from the pelvis, it extends the femur and brings the bent thigh into a line with the body. Taking its fixed point from below, it acts upon the pelvis, supporting it and the trunk upon the head of the femur. This is especially obvious in standing on one leg. Its most powerful action is to cause the body to regain the erect position after stooping, by drawing the pelvis backward, being assisted in this action by the biceps femoris, semitendinosus, and semimembranosus. The gluteus maximus is a tensor of the fascia lata, and by its connection with the iliotibial band steadies the femur on the articular surfaces of the tibia during standing, when the extensor muscles are relaxed. The lower part of the muscle also acts as an adductor and external rotator of the limb. The gluteus medius and minimus abduct the thigh when the limb is extended, and are principally called into action in supporting the body on one limb, in conjunction with the tensor fasciae lati. Their anterior fibers, by drawing the greater trochanter forward, rotate the thigh inward, in which action they are also assisted by the tensor fasciae lati. The tensor fasciae lati is a tensor of the fascia lata. Continuing its action, the oblique direction of its fibers enables it to abduct the thigh and to rotate it inward. In the erect posture, acting from below, it will serve to steady the pelvis upon the head of the femur, and by means of the iliotibial band it steadies the condyles of the femur on the articular surfaces of the tibia, and assists the gluteus maximus in supporting the knee in the extended position. The remaining muscles are powerful external rotators of the thigh. In the sitting posture, when the thigh is flexed upon the pelvis, their action as rotators ceases, and they become abductors, with the exception of the obturator externus, which still rotates the femur outward. 4. The posterior femoral muscles, hamstring muscles, biceps femoris, semitendinosus, semimembranosus. The biceps femoris, biceps, is situated on the posterior and lateral aspect of the thigh. It has two heads of origin. One, the long head, arises from the lower and inner impression on the back part of the tuberosity of the ischium, by a tendon common to it and the semitendinosus, and from the lower part of the sacrotuberous ligament. The other, the short head, arises from the lateral lip of the linea aspera, between the adductor magnus and vastus lateralis, extending up almost as high as the insertion of the gluteus maximus, from the lateral prolongation of the linea aspera to within 5 cm of the lateral condyle, and from the lateral intermuscular septum. The fibers of the long head form a fusiform belly, which passes obliquely downward and lateralward across the sciatic nerve to end in an aponeurosis which covers the posterior surface of the muscle, and receives the fibers of the short head. This aponeurosis becomes gradually contracted into a tendon, which is inserted into the lateral side of the head of the fibula, and by a small slip into the lateral condyle of the tibia. At its insertion the tendon divides into two portions, which embrace the fibular collateral ligament of the knee joint. From the posterior border of the tendon a thin expansion is given off to the fascia of the leg. The tendon of insertion of this muscle forms the lateral hamstring. The common peritoneal nerve descends along its medial border. Variations. The short head may be absent. Additional heads may arise from the ischial tuberosity, the linea aspera, the medial supracondylar ridge of the femur, or from various other parts. A slip may pass to the gastrocnemius. The semitendinosus, remarkable for the great length of its tendon of insertion, is situated at the posterior and medial aspect of the thigh. It arises from the lower and medial impression on the tuberosity of the ischium by a tendon common to it and the long head of the biceps femoris. It also arises from an aponeurosis which connects the adjacent surfaces of the two muscles to the extent of about 7½ centimeters from their origin. The muscle is fusiform and ends a little below the middle of the thigh in a long round tendon, which lies along the medial side of the popliteal fossa. It then curves around the medial condyle of the tibia and passes over the tibial collateral ligament of the knee joint, from which it is separated by a bursa, and is inserted into the upper part of the medial surface of the body of the tibia, nearly as far forward as its anterior crest. At its insertion it gives off from its lower border a prolongation to the deep fascia of the leg, and lies behind the tendon of the sartorius, and below that of the gracilis, to which it is united. A tendinous intersection is usually observed about the middle of the muscle. The semimembranosus, so called from its membranous tendon of origin, is situated at the back and medial side of the thigh. It arises by a thick tendon from the upper and outer impression on the tuberosity of the ischium, above and lateral to the biceps femoris and semitendinosus. The tendon of origin expands into an aponeurosis, which covers the upper part of the anterior surface of the muscle. From this aponeurosis muscular fibers arise and converge to another aponeurosis which covers the lower part of the posterior surface of the muscle and contracts into the tendon of insertion. It is inserted mainly into the horizontal groove on the posterior medial aspect of the medial condyle of the tibia. The tendon of insertion gives off certain fibrous expansions. One, of considerable size, passes upward and lateralward to be inserted into the back part of the lateral condyle of the femur, forming part of the oblique popliteal ligament of the knee joint. A second is continued downward to the fascia which covers the popliteus muscle, while a few fibers join the tibial collateral ligament of the joint and the fascia of the leg. The muscle overlaps the upper part of the popliteal vessels. Variations. It may be reduced or absent, or double, arising mainly from the sacrotuberous ligament and giving a slip to the femur or adductor magnus. The tendons of insertion of the two preceding muscles form the medial hamstrings. Nerves. The muscles of this region are supplied by the fourth and fifth lumbar and the first, second, and third sacral nerves. The nerve to the short head of the biceps femoris is derived from the common perineal. The other muscles are supplied through the tibial nerve. Actions. The hamstring muscles flex the leg upon the thigh. When the knee is semi-flexed, the biceps femoris, in consequence of its oblique direction, rotates the leg slightly outward, and the semitendinosus, and to a slight extent the semimembranosus, rotate the leg inward, assisting the popliteus. Taking their fixed point from below, these muscles serve to support the pelvis upon the head of the femur, and to draw the trunk directly backward, as in raising it from the stooping position or in feats of strength, when the body is thrown backward in the form of an arch. As already indicated, complete flexion of the hip cannot be effected unless the knee joint is also flexed, on account of the shortness of the hamstring muscles. End of section 51. Recording by Selena Arter.
Of Gray's Anatomy, Part 2. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Read by Laurie Ann Walden. Anatomy of the Human Body, Part 2, by Henry Gray. The Muscles and Fascia of the Leg, Part 1. The muscles of the leg may be divided into three groups: anterior, posterior, and lateral. 1. The anterior crural muscles: tibialis anterior, extensor digitorum longus, extensor hallucis longus, peroneus tertius. Deep fascia, fascia cruris. The deep fascia of the leg forms a complete investment to the muscles, and is fused with the periosteum over the subcutaneous surfaces of the bones. It is continuous above with the fascia lata, and is attached around the knee to the patella, the ligamentum patellae, the tuberosity and condyles of the tibia, and the head of the fibula. Behind it forms the popliteal fascia covering in the popliteal fossa. Here it is strengthened by transverse fibers, and perforated by the small saphenous vein. It receives an expansion from the tendon of the biceps femoris laterally, and from the tendons of the sartorius, gracilis, semitendinosus, and semimembranosus medially. In front it blends with the periosteum covering the subcutaneous surface of the tibia, and with that covering the head and malleolus of the fibula. Below it is continuous with the transverse crural and laciniate ligaments. It is thick and dense in the upper and anterior part of the leg, and gives attachment, by its deep surface, to the tibialis anterior and extensor digitorum longus, but thinner behind, where it covers the gastrocnemius and soleus. It gives off from its deep surface, on the lateral side of the leg, two strong intermuscular septa, the anterior and posterior perineal septa, which enclose the perinei longus and brevis, and separate them from the muscles of the anterior and posterior crural regions, and several more slender processes which enclose the individual muscles in each region. A broad transverse intermuscular septum, called the deep transverse fascia of the leg, intervenes between the superficial and deep posterior crural muscles. The tibialis anterior, tibialis anticus, is situated on the lateral side of the tibia. It is thick and fleshy above, tendinous below. It arises from the lateral condyle and upper half, or 2/3 of the lateral surface, of the body of the tibia, from the adjoining part of the interosseous membrane, from the deep surface of the fascia, and from the intermuscular septum between it and the extensor digitorum longus. The fibers run vertically downward and end in a tendon, which is apparent on the anterior surface of the muscle at the lower third of the leg. After passing through the most medial compartments of the transverse and cruciate crural ligaments, it is inserted into the medial and under surface of the first cuneiform bone, and the base of the first metatarsal bone. This muscle overlaps the anterior tibial vessels and deep perineal nerve in the upper part of the leg. Variations. A deep portion of the muscle is rarely inserted into the talus, or a tendinous slip may pass to the head of the first metatarsal bone or the base of the first phalanx of the great toe. The tibio-fascialis anterior, a small muscle from the lower part of the tibia to the transverse or cruciate crural ligaments, or deep fascia. The extensor hallucis longus, extensor proprius hallucis, is a thin muscle situated between the tibialis anterior and the extensor digitorum longus. It arises from the anterior surface of the fibula for about the middle 2/4 of its extent, medial to the origin of the extensor digitorum longus. It also arises from the interosseous membrane to a similar extent. The anterior tibial vessels and deep perineal nerve lie between it and the tibialis anterior. The fibers pass downward and end in a tendon, which occupies the anterior border of the muscle, passes through a distinct compartment in the cruciate crural ligament, crosses from the lateral to the medial side of the anterior tibial vessels near the bend of the ankle, and is inserted into the base of the distal phalanx of the great toe. Opposite the metatarso-phalangeal articulation, the tendon gives off a thin prolongation on either side, to cover the surface of the joint. An expansion from the medial side of the tendon is usually inserted into the base of the proximal phalanx. Variations. Occasionally united at its origin with the extensor digitorum longus, extensor ossis metatarsi hallucis, a small muscle, sometimes found as a slip from the extensor hallucis longus, or from the tibialis anterior, or from the extensor digitorum longus, or as a distinct muscle. It traverses the same compartment of the transverse ligament with the extensor hallucis longus. The extensor digitorum longus is a piniform muscle, situated at the lateral part of the front of the leg. It arises from the lateral condyle of the tibia, from the upper 3/4 of the anterior surface of the body of the fibula, from the upper part of the interosseous membrane, from the deep surface of the fascia, and from the intermuscular septa between it and the tibialis anterior on the medial, and the perinei on the lateral side. Between it and the tibialis anterior are the upper portions of the anterior tibial vessels and deep perineal nerve. The tendon passes under the transverse and cruciate crural ligaments, in company with the perineus tertius, and divides into 4 slips, which run forward on the dorsum of the foot, and are inserted into the second and third phalanges of the 4 lesser toes. The tendons to the second, third, and fourth toes are each joined opposite the metatarso-phalangeal articulation, on the lateral side by a tendon of the extensor digitorum brevis. The tendons are inserted in the following manner. Each receives a fibrous expansion from the interossei and lumbricalis, and then spreads out into a broad aponeurosis, which covers the dorsal surface of the first phalanx. This aponeurosis, at the articulation of the first with the second phalanx divides into 3 slips, an intermediate, which is inserted into the base of the second phalanx, and 2 collateral slips, which, after uniting on the dorsal surface of the second phalanx, are continued onward, to be inserted into the base of the third phalanx. Variations. This muscle varies considerably in the modes of origin and the arrangement of its various tendons. The tendons to the second and fifth toes may be found doubled, or extra slips are given off from one or more tendons to their corresponding metatarsal bones, or to the short extensor, or to one of the interosseous muscles. A slip to the great toe from the innermost tendon has been found. The peroneus tertius is a part of the extensor digitorum longus, and might be described as its fifth tendon. The fibers belonging to this tendon arise from the lower third or more of the anterior surface of the fibula, from the lower part of the interosseous membrane, and from an intermuscular septum between it and the peroneus brevis. The tendon, after passing under the transverse and cruciate crural ligaments, in the same canal as the extensor digitorum longus, is inserted into the dorsal surface of the base of the metatarsal bone of the little toe. This muscle is sometimes wanting. Nerves. These muscles are supplied by the fourth and fifth lumbar and first sacral nerves through the deep peroneal nerve. Actions. The tibialis anterior and peroneus tertius are the direct flexors of the foot at the ankle joint. The former muscle, when acting in conjunction with the tibialis posterior, raises the medial border of the foot, i.e., inverts the foot, and the latter, acting with the peronei brevis and longus, raises the lateral border of the foot, i.e., everts the foot. The extensor digitorum longus and extensor hallucis longus extend the phalanges of the toes, and, continuing their action, flex the foot upon the leg. Taking their fixed points from below, in the erect posture, all these muscles serve to fix the bones of the leg in the perpendicular position, and give increased strength to the ankle joint. 2. The posterior crural muscles. The muscles of the back of the leg are subdivided into 2 groups, superficial and deep. Those of the superficial group constitute a powerful muscular mass, forming the calf of the leg. Their large size is one of the most characteristic features of the muscular apparatus in man, and bears a direct relation to his erect attitude and his mode of progression. The superficial group: gastrocnemius, soleus, plantaris. The gastrocnemius is the most superficial muscle, and forms the greater part of the calf. It arises by 2 heads which are connected to the condyles of the femur by strong flat tendons. The medial and larger head takes its origin from a depression at the upper and back part of the medial condyle, and from the adjacent part of the femur. The lateral head arises from an impression on the side of the lateral condyle, and from the posterior surface of the femur immediately above the lateral part of the condyle. Both heads, also, arise from the subjacent part of the capsule of the knee. Each tendon spreads out into an aponeurosis, which covers the posterior surface of that portion of the muscle to which it belongs. From the anterior surfaces of these tendinous expansions, muscular fibers are given off, those of the medial head being thicker and extending lower than those of the lateral. The fibers unite at an angle in the middle line of the muscle in a tendinous raphe, which expands into a broad aponeurosis on the anterior surface of the muscle, and into this the remaining fibers are inserted. The aponeurosis, gradually contracting, unites with the tendon of the soleus, and forms with it the tendo calcaneus. Variations. Absence of the outer head or of the entire muscle. Extra slips from the popliteal surface of the femur. The soleus is a broad, flat muscle situated immediately in front of the gastrocnemius. It arises by tendinous fibers from the back of the head of the fibula, and from the upper third of the posterior surface of the body of the bone, from the popliteal line and the middle third of the medial border of the tibia, Some fibers also arise from a tendinous arch placed between the tibial and fibular origins of the muscle, in front of which the popliteal vessels and tibial nerve run. The fibers end in an aponeurosis which covers the posterior surface of the muscle, and, gradually becoming thicker and narrower, joins with the tendon of the gastrocnemius, and forms with it the tendo-calcaneus. Variations: accessory head to its lower and inner part usually ending in the tendo-calcaneus, or the calcaneus, or the laciniate ligament. The gastrocnemius and soleus together form a muscular mass which is occasionally described as the triceps surae. Its tendon of insertion is the tendo-calcaneus. Tendo-calcaneus, tendo-Achilles. The tendo-calcaneus, the common tendon of the gastrocnemius and soleus, is the thickest and strongest in the body. It is about 15 centimeters long and begins near the middle of the leg, but receives fleshy fibers on its anterior surface almost to its lower end. Gradually becoming contracted below, it is inserted into the middle part of the posterior surface of the calcaneus, a bursa being interposed between the tendon and the upper part of this surface. The tendon spreads out somewhat at its lower end, so that its narrowest part is about 4 centimeters above its insertion. It is covered by the fascia and the integument, and is separated from the deep muscles and vessels by a considerable interval filled up with areolar and adipose tissue. Along its lateral side, but superficial to it, is the small saphenous vein. The plantaris is placed between the gastrocnemius and soleus. It arises from the lower part of the lateral prolongation of the linea aspera, and from the oblique popliteal ligament of the knee joint. It forms a small fusiform belly, from 7 to 10 centimeters long, ending in a long, slender tendon which crosses obliquely between the two muscles of the calf, and runs along the medial border of the tendo-calcaneus, to be inserted with it into the posterior part of the calcaneus. This muscle is sometimes double, and at other times wanting. Occasionally its tendon is lost in the laciniate ligament, or in the fascia of the leg. Nerves. The gastrocnemius and soleus are supplied by the first and second sacral nerves, and the plantaris by the fourth and fifth lumbar and first sacral nerves, through the tibial nerve. Actions. The muscles of the calf are the chief extensors of the foot at the ankle joint. They possess considerable power, and are constantly called into use in standing, walking, dancing, and leaping; hence the large size they usually present. In walking, these muscles raise the heel from the ground. The body being thus supported on the raised foot, the opposite limb can be carried forward. In standing, the soleus, taking its fixed point from below, steadies the leg upon the foot and prevents the body from falling forward. The gastrocnemius, acting from below, serves to flex the femur upon the tibia, assisted by the popliteus. The plantaris is the rudiment of a large muscle which, in some of the lower animals, is continued over the calcaneus to be inserted into the plantar aponeurosis. In man it is an accessory to the gastrocnemius, extending the ankle if the foot be free, or bending the knee if the foot be fixed. End of section 52. Of Gray's Anatomy, Part 2. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recorded by Laurie Ann Walden. Anatomy of the Human Body, Part 2, by Henry Gray. The muscles and fascia of the leg, Part 2. The deep group. Popliteus, flexor digitorum longus, flexor hallucis longus, tibialis posterior. Deep transverse fascia. The deep transverse fascia of the leg is a transversely placed intermuscular septum between the superficial and deep muscles of the back of the leg. At the sides it is connected to the margins of the tibia and fibula. Above, where it covers the popliteus, it is thick and dense, and receives an expansion from the tendon of the semimembranosus. It is thinner in the middle of the leg. but below, where it covers the tendons passing behind the malleoli, it is thickened and continuous with the Laciniate ligament. The popliteus is a thin, flat, triangular muscle, which forms the lower part of the floor of the popliteal fossa. It arises by a strong tendon about 2.5 centimeters long, from a depression at the anterior part of the groove on the lateral condyle of the femur, and, to a small extent, from the oblique popliteal ligament of the knee joint, and is inserted into the medial 2/3 of the triangular surface above the popliteal line on the posterior surface of the body of the tibia, and into the tendinous expansion covering the surface of the muscle. Variations. Additional head from the sesamoid bone in the outer head of the gastrocnemius. Popliteus minor, rare, origin from femur on the inner side of the plantaris, insertion into the posterior ligament of the knee joint. Peroneotibialis, 14%, origin, inner side of the head of the fibula, insertion into the upper end of the oblique line of the tibia, it lies beneath the popliteus. The flexor hallucis longus is situated on the fibular side of the leg. It arises from the inferior 2/3 of the posterior surface of the body of the fibula, with the exception of 2.5 centimeters at its lowest part, from the lower part of the interosseous membrane, from an intermuscular septum between it and the peronei laterally, and from the fascia covering the tibialis posterior medially. The fibers pass obliquely downward and backward, and end in a tendon which occupies nearly the whole length of the posterior surface of the muscle. This tendon lies in a groove which crosses the posterior surface of the lower end of the tibia, the posterior surface of the talus, and the under surface of the sustentaculum tali of the calcaneus. In the sole of the foot it runs forward between the two heads of the flexor hallucis brevis, and is inserted into the base of the last phalanx of the great toe. The grooves on the talus and calcaneus, which contain the tendon of the muscle, are converted by tendinous fibers into distinct canals, lined by a mucous sheath. As the tendon passes forward in the sole of the foot, it is situated above, and crosses from the lateral to the medial side of the tendon of the flexor digitorum longus, to which it is connected by a fibrous slip. Variations. Usually a slip runs to the flexor digitorum, and frequently an additional slip runs from the flexor digitorum to the flexor hallucis. Peroneocalcaneus internus, rare, origin below or outside the flexor hallucis from the back of the fibula, passes over the sustentaculum tali with the flexor hallucis, and is inserted into the calcaneum. The flexor digitorum longus is situated on the tibial side of the leg. At its origin it is thin and pointed, but it gradually increases in size as it descends. It arises from the posterior surface of the body of the tibia, from immediately below the popliteal line to within 7 or 8 centimeters of its lower extremity, medial to the tibial origin of the tibialis posterior. It also arises from the fascia covering the tibialis posterior. The fibers end in a tendon, which runs nearly the whole length of the posterior surface of the muscle. This tendon passes behind the medial malleolus in a groove common to it and the tibialis posterior, but separated from the latter by a fibrous septum, each tendon being contained in a special compartment lined by a separate mucous sheath. It passes obliquely forward and lateralward, superficial to the deltoid ligament of the ankle joint, into the sole of the foot, where it crosses below the tendon of the flexor hallucis longus, and receives from it a strong tendinous slip. It then expands and is joined by the quadratus plantae, and finally divides into 4 tendons which are inserted into the bases of the last phalanges of the 2nd, 3rd, 4th, and 5th toes, each tendon passing through an opening in the corresponding tendon of the flexor digitorum brevis, opposite the base of the first phalanx. Variations. Flexor accessorius longus digitorum, not infrequent, origin from fibula or tibia or the deep fascia, and ending in a tendon which, after passing beneath the Laciniate ligament, joins the tendon of the long flexor or the quadratus plantae. The tibialis posterior, tibialis posticus, lies between the two preceding muscles and is the most deeply seated of the muscles on the back of the leg. It begins above by two pointed processes, separated by an angular interval through which the anterior tibial vessels pass forward to the front of the leg. It arises from the whole of the posterior surface of the interosseous membrane, excepting its lowest part, from the lateral portion of the posterior surface of the body of the tibia, between the commencement of the popliteal line above and the junction of the middle and lower thirds of the body below, and from the upper 2/3 of the medial surface of the fibula. Some fibers also arise from the deep transverse fascia and from the intermuscular septa separating it from the adjacent muscles. In the lower fourth of the leg its tendon passes in front of that of the flexor digitorum longus and lies with it in a groove behind the medial malleolus, but enclosed in a separate sheath. It next passes under the laciniate and over the deltoid ligament into the foot, and then beneath the plantar calcaneo-navicular ligament. The tendon contains a sesamoid fibrocartilage, as it runs under the plantar calcaneo-navicular ligament. It is inserted into the tuberosity of the navicular bone, and gives off fibrous expansions, one of which passes backward to the sustentaculum tali of the calcaneus, others forward and lateralward to the three cuneiforms, the cuboid, and the bases of the second, third, and fourth metatarsal bones. Nerves. The popliteus is supplied by the fourth and fifth lumbar and first sacral nerves, the flexor digitorum longus and tibialis posterior by the fifth lumbar and first sacral, and the flexor hallucis longus by the fifth lumbar and the first and second sacral nerves through the tibial nerve. Actions. The popliteus assists in flexing the leg upon the thigh. When the leg is flexed, it will rotate the tibia inward. It is especially called into action at the beginning of the act of bending the knee, inasmuch as it produces the slight inward rotation of the tibia which is essential in the early stage of this movement. The tibialis posterior is a direct extensor of the foot at the ankle joint. Acting in conjunction with the tibialis anterior, it turns the sole of the foot upward and medialward, i.e., inverts the foot, antagonizing the peronei, which turn it upward and lateralward, or evert it. In the sole of the foot, the tendon of the tibialis posterior lies directly below the plantar calcaneo-navicular ligament, and is therefore an important factor in maintaining the arch of the foot. The flexor digitorum longus and flexor hallucis longus are the direct flexors of the phalanges, and, continuing their action, extend the foot upon the leg. They assist the gastrocnemius and soleus in extending the foot, as in the act of walking, or in standing on tiptoe. In consequence of the oblique direction of its tendons, the flexor digitorum longus would draw the toes medialward, were it not for the quadratus plantae, which is inserted into the lateral side of the tendon, and draws it to the middle line of the foot. Taking their fixed point from the foot, these muscles serve to maintain the upright posture by steadying the tibia and fibula perpendicularly upon the talus. 3. The lateral crural muscles, peroneus longus, peroneus brevis. The peroneus longus is situated at the upper part of the lateral side of the leg, and is the more superficial of the two muscles. It arises from the head and upper 2/3 of the lateral surface of the body of the fibula, from the deep surface of the fascia, and from the intermuscular septa between it and the muscles on the front and back of the leg, occasionally also by a few fibers from the lateral condyle of the tibia. Between its attachments to the head and to the body of the fibula there is a gap through which the common peroneal nerve passes to the front of the leg. It ends in a long tendon, which runs behind the lateral malleolus, in a groove common to it and the tendon of the peroneus brevis, behind which it lies. The groove is converted into a canal by the superior peroneal retinaculum, and the tendons in it are contained in a common mucous sheath. The tendon then extends obliquely forward across the lateral side of the calcaneus, below the trochlear process, and the tendon of the peroneus brevis, and under cover of the inferior peroneal retinaculum. It crosses the lateral side of the cuboid, and then runs on the under surface of that bone, in a groove which is converted into a canal by the long plantar ligament. The tendon then crosses the sole of the foot obliquely, and is inserted into the lateral side of the base of the first metatarsal bone, and the lateral side of the first cuneiform. Occasionally it sends a slip to the base of the second metatarsal bone. The tendon changes its direction at 2 points: first, behind the lateral malleolus; secondly, on the cuboid bone. In both of these situations the tendon is thickened, and in the latter a sesamoid fibrocartilage, sometimes a bone, is usually developed in its substance. The peroneus brevis lies under cover of the peroneus longus, and is a shorter and smaller muscle. It arises from the lower 2/3 of the lateral surface of the body of the fibula, medial to the peroneus longus, and from the intermuscular septa separating it from the adjacent muscles on the front and back of the leg. The fibers pass vertically downward and end in a tendon which runs behind the lateral malleolus, along with, but in front of, that of the preceding muscle, the two tendons being enclosed in the same compartment, and lubricated by a common mucous sheath. It then runs forward on the lateral side of the calcaneus, above the trochlear process and the tendon of the peroneus longus, and is inserted into the tuberosity at the base of the fifth metatarsal bone on its lateral side. On the lateral surface of the calcaneus, the tendons of the peronei longus and brevis occupy separate osseo-aponeurotic canals formed by the calcaneus and the peroneal retinacula. Each tendon is enveloped by a forward prolongation of the common mucous sheath. Variations. Fusion of the two peronei is rare. A slip from the peroneus longus to the base of the third, fourth, or fifth metatarsal bone, or to the adductor hallucis, is occasionally seen. Peroneus accessorius, origin from the fibula between the longus and brevis, joins the tendon of the longus in the sole of the foot. Peroneus quinti digiti, rare, origin lower fourth of the fibula, under the brevis, insertion into the extensor aponeurosis of the little toe. More common as a slip of the tendon of the peroneus brevis. Peroneus quartus, 13%, Gruber, origin back of fibula between the brevis and the flexor hallucis, insertion into the peroneal spine of the calcaneum, peroneocalcaneus externum, or, less frequently, into the tuberosity of the cuboid, peroneocuboideus. Nerves. The peronei longus and brevis are supplied by the fourth and fifth lumbar and first sacral nerves through the superficial peroneal nerve. Actions. The peronei longus and brevis extend the foot upon the leg, in conjunction with the tibialis posterior, antagonizing the tibialis anterior and peroneus tertius, which are flexors of the foot. The peroneus longus also everts the sole of the foot, and from the oblique direction of the tendon across the sole of the foot is an important agent in the maintenance of the transverse arch. Taking their fixed points below, the peronei serve to steady the leg upon the foot. This is especially the case in standing upon one leg, when the tendency of the superincumbent weight is to throw the leg medialward. The peroneus longus overcomes this tendency by drawing on the lateral side of the leg. End of section 53.
Of Gray's Anatomy, Part 2. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Anatomy of the Human Body, Part 2, by Henry Gray. The fasciae around the ankle. Fibrous bands or thickened portions of the fascia bind down the tendons in front of and behind the ankle in their passage to the foot. They comprise 3 ligaments, that is, the transverse crewel, the cruciate crewel, and the laciniate. and the superior and inferior perineal retinacula. Transverse crural ligament, ligamentum transversum cruris, upper part of anterior annular ligament. The transverse crural ligament binds down the tendons of extensor digitorum longus, extensor hallucis longus, peroneus tertius, and tibialis anterior, as they descend on the front of the tibia and fibula. Under it are found also the anterior tibial vessels and deep perineal nerve. It is attached laterally to the lower end of the fibula, and medially to the tibia. Above, it is continuous with the fascia of the leg. Cruciate crural ligament, ligamentum cruciatum cruris, lower part of anterior annular ligament. The cruciate crural ligament is a Y-shaped band placed in front of the ankle joint, the stem of the Y being attached laterally to the upper surface of the calcaneus, in front of the depression for the interosseous talocanian ligament. It is directed medialward as a double layer, one lamina passing in front of, and the other behind, the tendons of the peroneus tertius and extensor digitorum longus. At the medial border of the latter tendon, these two layers join together, forming a compartment in which the tendons are enclosed. From the medial extremity of this sheath the two limbs of the Y diverge. One is directed upward and medialward, to be attached to the tibial malleolus, passing over the extensor hallucis longus and the vessels and nerves, but enclosing the tibialis anterior by a splitting of its fibers. The other limb extends downward and medialward to be attached to the border of the plantar aponeurosis, and passes over the tendons of the extensor hallucis longus and tibialis anterior, and also the vessels and nerves. Laciniate ligament, ligamentum laciniatum, internal annular ligament. The laciniate ligament is a strong fibrous band extending from the tibial malleolus above to the margin of the calcaneus below, converting a series of bony grooves in this situation into canals for the passage of the tendons of the flexor muscles and the posterior tibial vessels and the tibial nerve into the sole of the foot. It is continuous by its upper border with the deep fascia of the leg, and by its lower border with the plantar aponeurosis and the fibers of origin of the abductor hallucis muscle. Enumerated from the medial side, the four canals which it forms transmit the tendon of the tibialis posterior, the tendon of the flexor digitorum longus, the posterior tibial vessels and tibial nerve, which run through a broad space beneath the ligament, and lastly, in a canal formed partly by the talus, the tendon of the flexor hallucis longus. Perineal retinacula. The perineal retinacula are fibrous bands which bind down the tendons of the peronei longus and brevis, as they run across the lateral side of the ankle. The fibers of the superior retinaculum, external annular ligament, are attached above to the lateral malleolus and below to the lateral surface of the calcaneus. The fibers of the inferior retinaculum are continuous in front with those of the cruciate crural ligament. Behind, they are attached to the lateral surface of the calcaneus. Some of the fibers are fixed to the perineal trochlea, forming a septum between the tendons of the peronei longus and brevis. The mucous sheaths of the tendons around the ankle. All the tendons crossing the ankle joint are enclosed for part of their length in mucous sheaths which have an almost uniform length of about 8 centimeters each. On the front of the ankle, the sheath for the tibialis anterior extends from the upper margin of the transverse crural ligament to the interval between the diverging limbs of the cruciate ligament. Those for the extensor digitorum longus and extensor hallucis longus reach upward to just above the level of the tips of the malleoli, the former being the higher. The sheath of the extensor hallucis longus is prolonged on the base of the first metatarsal bone, while that of the extensor digitorum longus reaches only to the level of the base of the fifth metatarsal. On the medial side of the ankle, the sheath for the tibialis posterior extends highest up, to about 4 centimeters above the tip of the malleolus, while below it stops just short of the tuberosity of the navicular. The sheath for the flexor hallucis longus reaches up to the level of the tip of the malleolus, while that for the flexor digitorum longus is slightly higher. The former is continued to the base of the first metatarsal, but the latter stops opposite the first cuneiform bone. On the lateral side of the ankle, a sheath which is single for the greater part of its extent encloses the peronei longus and brevis. It extends upward for about 4 centimeters above the tip of the malleolus, and downward and forward for about the same distance. End of section 54.
Section 55 of Gray's Anatomy Part 2. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by The Bodster. Anatomy of the Human Body Part 2 by Henry Gray. Section 8E, the muscles and fascia of the foot. The dorsal muscle of the foot, extensor digitorum brevis. The fascia on the dorsum of the foot is a thin membranous layer continuous above with the transverse and cruciate crural ligaments. On either side it blends with the plantar aponeurosis. Anteriorly it forms a sheath for the tendons on the dorsum of the foot. The extensor digitorum brevis is a broad thin muscle which arises from the forepart of the upper and lateral surfaces of the calcaneus, in front of the groove for the peroneus brevis, from the lateral talocalcanean ligament, and from the common limb of the cruciate crural ligament. It passes obliquely across the dorsum of the foot and ends in 4 tendons. The most medial, which is the largest, is inserted into the dorsal surface of the base of the first phalanx of the great toe, crossing the dorsalis pedis artery. It is frequently described as a separate muscle, the extensor hallucis brevis. The other 3 are inserted into the lateral sides of the tendon of the extensor digitorum longus of the 2nd, 3rd, and 4th toes. Variations. Accessory slips of origin from the talus and navicular, or from the external cuneiform and 3rd metatarsal bones to the 2nd slip of the muscle, and one from the cuboid to the 3rd slip, have been observed. The tendons vary in number and position. They may be reduced to 2, or one of them may be doubled, or an additional slip may pass to the little toe. A supernumerary slip ending on one of the metatarsophalangeal articulations or joining a dorsal interosseous muscle is not uncommon. Deep slips between the muscle and the dorsal interosseae occur. Nerves. It is supplied by the deep peroneal nerve. Actions. The extensor digitorum brevis extends the phalanges of the 4 toes into which it is inserted, but in the great toe acts only on the first phalanx. The obliquity of its direction counteracts the oblique movement given to the toes by the long extensor, so that when both muscles act, the toes are evenly extended. The plantar muscles of the foot. Plantar aponeurosis, aponeurosis plantaris, plantar fascia. The plantar aponeurosis is of great strength and consists of pearly white glistening fibres disposed for the most part longitudinally. It is divided into central, lateral, and medial portions. The central portion, the thickest, is narrow behind and attached to the medial process of the tuberosity of the calcaneus, posterior to the origin of the flexor digitorum brevis, and becoming broader and thinner in front, divides near the heads of the metatarsal bones into 5 processes, one for each of the toes. Each of these processes divides opposite the metatarsophalangeal articulation into two strata, superficial and deep. The superficial stratum is inserted into the skin of the transverse sulcus, which separates the toes from the sole. The deeper stratum divides into two slips which embrace the side of the flexor tendons of the toes and blend with the sheaths of the tendons and with the transverse metatarsal ligament, thus forming a series of arches through which the tendons of the short and long flexors pass to the toes. The intervals left between the 5 processes allow the digital vessels and nerves and the tendons of the lumbricalis to become superficial. At the point of division of the aponeurosis, numerous transverse fasciculi are superadded. These serve to increase the strength of the aponeurosis at this part by binding the processes together and connecting them with the integument. The central portion of the plantar aponeurosis is continuous with the lateral and medial portions that sends upward to the foot at the lines of junction 2 strong vertical intermuscular septa, broader in front than behind, which separate the intermediate from the lateral and medial plantar groups of muscles. From these again are derived thinner transverse septa, which separate the various layers of muscles in this region. The upper surface of this aponeurosis gives origin behind to the flexor digitorum brevis. The lateral and medial portions of the plantar aponeurosis are thinner than the central piece and cover the sides of the sole of the foot. The lateral portion covers the undersurface of the abductor digiti quinti. It is thin in front and thick behind, where it forms a strong band between the lateral process of the tuberosity of the calcaneus and the base of the 5th metatarsal bone. It is continuous medially with the central portion of the plantar aponeurosis and laterally with the dorsal fascia. The medial portion is thin and covers the undersurface of the abductor hallucis. It is attached behind to the laciniate ligament and is continuous around the side of the foot with the dorsal fascia and laterally with the central portion of the plantar aponeurosis. The muscles in the plantar region of the foot may be divided into 3 groups, in a similar manner to those in the hand. Those of the medial plantar region are connected with the great toe and correspond with those of the thumb. Those of the lateral plantar region are connected with the little toe and correspond with those of the little finger. And those of the intermediate plantar region are connected with the tendons intervening between the 2 former groups. But in order to facilitate the description of these muscles, it is more convenient to divide them into 4 layers in the order in which they are successively exposed. The first layer: abductor hallucis, flexor digitorum brevis, and abductor digiti quinti. The abductor hallucis lies along the medial border of the foot and covers the origins of the plantar vessels and nerves. It arises from the medial process of the tuberosity of the calcaneus, from the laciniate ligament, and from the plantar aponeurosis, and from the intermuscular septum between it and the flexor digitorum brevis. The fibres end in a tendon, which is inserted together with the medial tendon of the flexor hallucis brevis into the tibial side of the base of the phalanx of the great toe. Variations slip to the base of the first phalanx of the second toe. The flexor digitorum brevis lies in the middle of the sole of the foot, immediately above the central part of the plantar aponeurosis, with which it is firmly united. Its deep surface is separated from the lateral plantar vessels and nerves by a thin layer of fascia. It arises by a narrow tendon from the medial process of the tuberosity of the calcaneus, from the central part of the plantar aponeurosis, and from the intermuscular septa between it and the adjacent muscles. It passes forward and divides into 4 tendons, 1 for each of the 4 lesser toes. Opposite the bases of the first phalanges, each tendon divides into 2 slips to allow the passage of the corresponding tendon of the flexor digitorum longus. The 2 portions of the tendon then unite and form a grooved channel for the reception of the accompanying long flexor tendon. Finally, it divides a second time and is inserted into the sides of the second phalanx about its middle. The mode of division of the tendons of the flexor digitorum brevis, and of their insertion into the phalanges, is analogous to that of the tendons of the flexor digitorum sublimis in the hand. Variations. Slip to the little toe frequently wanting 23%, or it may be replaced by a small fusiform muscle arising from the long flexor tendon or from the quadratus plantae. Fibrous sheaths of the flexor tendons. The terminal portions of the tendons of the long and short flexor muscles are contained in the osseo-aponeurotic canals, similar in their arrangement to those in the fingers. These canals are formed above by the phalanges and below by the fibrous bands, which arch across the tendons and are attached on either side to the margins of the phalanges. Opposite the bodies of the proximal and second phalanges, the fibrous bands are strong, and the fibres are transverse, but opposite the joints they are much thinner, and the fibres are directed obliquely. Each canal contains a mucous sheath, which is reflected on the contained tendons. The abductor digiti quinti, abductor minimi digiti, lies along the lateral border of the foot and is in relation to its medial margin with the lateral plantar vessels and nerves. It arises by a broad origin from the lateral process of the tuberosity of the calcaneus, from the undersurface of the calcaneus between the two processes of the tuberosity, from the forepart of the medial process, from the plantar aponeurosis, and from the intermuscular septum between it and the flexor digitorum brevis. Its tendon, after gliding over a smooth facet on the undersurface of the base of the fifth metatarsal bone, is inserted with the flexor digiti quinti brevis into the fibular side of the base of the first phalanx of the fifth toe. Variations. Slips of origin from the tuberosity at the base of the fifth metatarsal. Abductor ossus metatarsi quinti, origin external tubercle of the calcaneus, insertion into the tuberosity of the fifth metatarsal bone in common with or beneath the outer margin of the plantar fascia. The second layer, quadratus plantae and lumbricalis. The quadratus plantae, flexor accessorius, is separated from the muscles of the first layer by the lateral plantar vessels and nerve. It arises by two heads, which are separated from each other by the long plantar ligament. The medial or larger head is muscular and is attached to the medial concave surface of the calcaneus, below the groove which lodges the tendon of the flexor hallucis longus. The lateral head, flat and tendinous, arises from the lateral border of the inferior surface of the calcaneus, in front of the lateral process of its tuberosity, and from the long plantar ligament. The two portions join at an acute angle, and end in a flattened band which is inserted into the lateral margin and upper and under surfaces of the tendon of the flexor digitorum longus, forming a kind of groove in which the tendon is lodged. It usually sends slips to those tendons of the flexor digitorum longus which pass to the second, third, and fourth toes. Variations. Lateral head often wanting, entire muscle absent. Variation in the number of digital tendons to which fibres can be traced. Most frequent offsets are sent to the second, third, and fourth toes, in many cases to the fifth as well, occasionally to two toes only. The lumbricalis are four small muscles, accessory to the tendons of the flexor digitorum longus, and numbered from the medial side of the foot. They arise from these tendons as far back as their angles of division, each springing from two tendons, except the first. The muscles end in tendons, which pass forward on the medial sides of the four lesser toes, and are inserted into the expansions of the tendons of the extensor digitorum longus on the dorsal surfaces of the first phalanges. Variations. Absence of one or more. Doubling of the third or fourth. Insertion partly or wholly into the first phalanges. The third layer. Flexor hallucis brevis, adductor hallucis, flexor digiti quinti brevis. The flexor hallucis brevis arises by a pointed tendinous process from the medial part of the undersurface of the cuboid bone, from the contiguous portion of the third cuneiform and from the prolongation of the tendon of the tibialis posterior, which is attached to that bone. It divides in front into two portions, which are inserted into the medial and lateral sides of the base of the first phalanx of the great toe, a sesamoid bone being present in each tendon at its insertion. The medial portion is blended with the abductor hallucis previous to its insertion, the lateral portion of the adductor hallucis. The tendon of the flexor hallucis longus lies in a groove between them. The lateral portion is sometimes described as the first interosseous plantaris. Variations. Origin subject to considerable variation. It often receives fibres from the calcaneus or long plantar ligament. Attachment to the cuboid, sometimes wanting. Slip to first phalanx of second toe. The adductor hallucis, adductor obliquus hallucis, arises by two heads, oblique and transverse. The oblique head is a large, thick, fleshy mass crossing the foot obliquely and occupying the hollow space under the first, second, third, and fourth metatarsal bones. It arises from the bases of the second, third, and fourth metatarsal bones and from the sheath of the tendon of the peroneus longus, and is inserted, together with the lateral portion of the flexor hallucis brevis, into the lateral side of the base of the first phalanx of the great toe. The transverse head, transversus pedis, is a narrow, flat fasciculus, which arises from the plantar metatarsophalangeal ligaments of the third, fourth, and fifth toes, sometimes only from the third and fourth, and from the transverse ligament of the metatarsus. It is inserted into the lateral side of the base of the first phalanx of the great toe, its fibres blending with the tendon of insertion of the oblique head. Variations. Slips to the base of the first phalanx of the second toe, opponens hallucis, occasional slips from the adductor to the metatarsal bone of the great toe. The abductor, flexor brevis, and adductor of the great toe, like the similar muscles of the thumb, give off, at their insertions, fibrous expansions to blend with the tendons of the extensor digitorum longus. The flexor digiti quinti brevis, flexor brevis minimi digiti, lies under the metatarsal bone of the little toe, and resembles one of the interossei. It arises from the base of the fifth metatarsal bone, and from the sheath of the peroneus longus. Its tendon is inserted into the lateral side of the base of the first phalanx of the fifth toe. Occasionally, a few of the deeper fibres are inserted into the lateral part of the distal half of the fifth metatarsal bone. These are described by some as a distinct muscle, the opponens digiti quinti. The fourth layer, interossei. The interossei in the foot are similar to those in the hand, with this exception, that they are grouped around the middle line of the second digit instead of that of the third. They are 7 in number and consist of two groups, dorsal and plantar. The interossei dorsalis, dorsalis interossei, 4 in number, are situated between the metatarsal bones. They are bipeniform muscles, each arising by two heads from the adjacent sides of the metatarsal bones between which it is placed. Their tendons are inserted into the bases of the first phalanges and into the aponeurosis of the tendons of the extensor digitorum longus. In the angular interval left between the heads of each of the three lateral muscles, one of the perforating arteries passes to the dorsum of the foot. Through the space between the heads of the first muscle, the deep plantar branch of the dorsalis pedis artery enters the sole of the foot. The first is inserted into the medial side of the second toe. The other three are inserted into the lateral sides of the second, third, and fourth toes. The interossei plantaris, plantar interossei, 3 in number, lie beneath rather than between the metatarsal bones, and each is connected with but one metatarsal bone. They arise from the bases and medial sides of the bodies of the third, fourth, and fifth metatarsal bones, and are inserted into the medial sides of the bases of the first phalanges of the same toes, and into the aponeuroses of the tendons of the extensor digitorum longus. Nerves. The flexor digitorum brevis, the flexor hallucis brevis, the abductor hallucis, and the first lumbricalis are supplied by the medial plantar nerve. All the other muscles in the sole of the foot by the lateral plantar. The first interosseous dorsalis frequently receives an extra filament from the medial branch of the deep peroneal nerve on the dorsum of the foot, and the second interosseous dorsalis a twig from the lateral branch of the same nerve. Actions. All the muscles of the foot act upon the toes and may be grouped as abductors, adductors, flexors, or extensors. The abductors are the interossei dorsalis, the abductor hallucis, and the abductor digiti quinti. The interossei dorsalis are abductors from an imaginary line passing through the axis of the second toe, so that the first muscle draws the second toe medialward toward the great toe, the second muscle draws the same toe lateralward, and the third and fourth draw the third and fourth toes in the same direction. Like the interossei in the hand, each assists in flexing the first phalanx and extending the second and third phalanges. The abductor hallucis abducts the great toe from the second and also flexes its proximal phalanx. In the same way, the action of the abductor digiti quinti is twofold, as an abductor of this toe from the fourth, and also as a flexor of its proximal phalanx. The adductors are the interossei plantaris and the adductor hallucis. The interossei plantaris adduct the third, fourth, and fifth toes towards the imaginary line passing through the second toe, and by means of their insertions into the aponeuroses of the extensor tendons, they assist in flexing the proximal phalanges and extending the middle and terminal phalanges. The oblique head of the adductor hallucis is chiefly concerned in adducting the great toe toward the second one, but also assists in flexing this toe. The transverse head approximates all the toes and thus increases the curve of the transverse arch of the metatarsus. The flexors are the flexor digitorum brevis, the quadratus plantae, the flexor hallucis brevis, the flexor digiti quinti brevis, and the lumbricalis. The flexor digitorum brevis flexes the second phalanges upon the first, and continuing its action, flexes the first phalanges also, and brings the toes together. The quadratus plantae assists the flexor digitorum longus and converts the oblique pull of the tendons of that muscle into a direct backward pull upon the toes. The flexor digiti quinti brevis flexes the little toe and draws its metatarsal bone downward and medialward. The lumbricalis, like the corresponding muscles in the hand, assist in flexing the proximal phalanges, and by their insertions into the tendons of the extensor digitorum longus, aid that muscle in straightening the middle and terminal phalanges. The extensor digitorum brevis extends the first phalanx of the great toe and assists the long extensor in extending the next three toes, and at the same time gives to the toes a lateral direction when they are extended.
End of section 55, and also the end of Anatomy of the Human Body, Part 2, by Henry Gray. Recording by The Bodster.